Well, everyone, now that the kids are back in school and hopefully you have time to breathe, it might be time to focus inward and take better care of yourself. You don't like what you see in the mirror? Well, luckily, the Aesthetic Associates Center can provide great help. Now, today, Dr. Sam Shatkin Jr. is here to talk about their holistic approach to body contouring, image, and weight loss. And not all of it is the plastic surgeon part. There's a lot of people's self-image that can be done before we even talk about that.
Exactly.
Yeah.
Well, you know me, Linda. What I do in my practice is I have to evaluate the patient first of all, and if they're not willing to commit to being healthier, and it's not just about doing surgery, they need to be healthier for me to have a successful result. And just making them look better doesn't do that. So what we need to do, and we spend a lot of time talking to the patients about how to look better and feel better and have that energy better. They sleep better at night, they wake up more refreshed in the morning, and they can go about their day with much more efficiency than they ever did. And it's not just about liposuction or body contouring or shaping.
Yeah, and let's face it, ladies, our bodies change halfway through life somewhere. It's not yours anymore. Something happens, and you feel like you're like totally out of control. But there's ways that we can get it back.
Right.
And there's changes that we have to make to accommodate that aging process.
Exactly. I mean, and that's part of the problem. The hormones do change for women, and it's a lot different than men. So the metabolism definitely goes down. So there's a lot of things that the women need to do that are different from the men. And there's a new program that we're introducing in our practice called Lifestyle System. And essentially what it does is it's a 12-week program which really teaches you the lifestyle changes, the low glycemic food. You know, we know that diets really don't work. Statistically, most people gain the weight or have more weight after they've been on a regular diet. So this is sort of a lifestyle change that people need to understand. And this type of lifestyle change has worked for me. I'm sure it'll work for my patients. I've had several patients that have lost over 50 to 100 pounds just with making the right decisions. It's not about cookbook diet. It's not about counting carbs. It's about understanding what you need to eat and why you eat it. And then when I do that, the results will be so much better when I do the tummy tuck or the liposuction.
So that's the last part of it.
Right. Well, it's actually, we incorporate it all together. It's all part of the same thing because we want to make them look their best. And it's not just what I can do surgically, it's what we can do together. Okay,
we have some pictures, and we're going to show some befores and afters.
Some of these pictures are from the American Society of Plastic Surgeons and the Aesthetic Society Plastic Surgeons. These are just typical before and after. So patients that have lost this weight then need to shape and contour.
Right.
And sometimes they're from pregnancies, it's not just from weight gain. But here's a perfect example of what we can do to really contour and shape the tummy.
Okay.
And we have some other shots too if we can go over those as well.
All right, let's get past this one.
This is an abdominoplasty, and this is the side view of that same patient. Sometimes we carry that incision around the back because they have extra skin there, and it can really, really beautifully shape the body. So once we've gotten them under control with their lifestyle, another perfect example, someone that had excess weight, lost some of that weight, and again, most of this and a lot of this is contributed to pregnancies, but not exclusively, and they can get much better results when we can tighten up the skin.
Right.
And the end result is that you want to look good. You want to look your best, but you also want to be healthy.
Well, it just seems so unfair that, you know, for a woman to start a family or have a family, it's something that you're so excited about. It's such a happy thing. And then you end up with this tremendously bad body. Well, some women do, you know, and it's just like so unfair because you look so, it gives you such a poor self-image of yourself.
Well, there are some patients that come to my office that I never do surgery on because I help them with the help of my staff to understand what they need to do to make some changes. And sometimes they can lose 5, 10, 15 pounds and I may never see them again, which is fine with me because the goal, as I mentioned, is to try to get them healthier. If I can get them to lose the weight on their own and they don't need any skin tightening, they don't need any liposuction later, fine. But the thing that's most important is that they make that decision to take that step to be healthier, and I know this transitions program will help them.
Now, do people meet in a group? How does this work?
It's group. It's great because, well, there's a set communicative lecture that's during the process, an hour and a half once a week. And after that, there's a little didactic information they're going to get, and then they go home and they start implementing the things that they learned. And they do that over the 12-week program, and it's very well defined, very well set. And there is that group dynamic where they can interact among themselves and let people know what kind of issues they're having.
Right, and if you can commiserate with somebody else and say, did you have this? Yeah, I had that too.
Not to mention the fact that then when they go to the next session, they're going to want to see each other and see what each of them have succeeded with. So it sort of is a good
it's a good support system, especially if you don't have anybody in your family who you can talk to that's your age. You know what I mean? The issues aren't quite the same. You can
the issues are different, exactly.
You know, you can go and find somebody who's maybe dealing with the same
everybody's
thing.
got different issues.
Yeah. So. Now you've brought some products too. This is new?
Well, yeah, getting away from the body contour. We have our new products. As I mentioned, we were bringing those on. This is the Aura products that we have now. Aura is the plural of aura, so people have a lot of looks about them, and these products are tremendous. We've got the new anti-wrinkle cream, and if you can sort of zoom in on this, this is a really neat product. We incorporate gold flakes in this, and the gold is releases the toxins from the skin, so that the other
gold was a good thing.
Yeah, it's a good thing for a lot of reasons, but it can also help. Then the products can enter the skin much more readily and be more beneficial. And we've got a full acne skincare line and some eye cream and other things. And
well, that's great, because while you are working on the inside and working on the head, I think people do like to see what the latest products are from the doctor that are going to give you the best.
Well, these are products that only we have. These are exclusive products in our office, and we have a one-stop shop essentially. So you want to look good on the outside, the inside. We can incorporate all of that to make them look better and feel better, and that's ultimately the goal.
I think it's perfect now that the kids are back in school. Mom's got some time.
Well, that's a good point.
Yeah,
that's a good
we
point.
have a phone call for you, Dr.
Great,
Shatkin.
beautiful.
Hello, welcome. Hi, caller, you there?
Yes, ma'am.
Go ahead, please.
Hello.
This is Judy Johnson.
Hello.
I'm calling about some fat around my middle.
Okay.
I go on a diet and I lose 10 pounds and then I gain 20 pounds back.
Yeah.
So I was wondering how I could lose the weight without having to go on a strict diet or anything.
Well, there's a great question. There's nothing strict about the Lifestyles program. There's nothing strict about losing weight. What you need to do is understand what you need to do to change your lifestyle. Avoid the foods that are no good. Start to incorporate the things in your lifestyle that you know are healthy, and it'll start to come off on its own. And it's not just about weight loss either, Judy. It's also about being healthier. So, for example, someone like myself, and I feel like I'm in good shape because I've been following these regimens for many years, I can learn from this. I can learn what to do in my life to make myself healthier. It's not just about losing weight, it's about living better.
Because obviously you know how to lose the weight.
And living longer, too.
It's the part after that. It's the lifestyle. It's not just a diet that's putting the weight back on.
That's why it's called lifestyle system, exactly.
So it's perfect. People can find out about this by calling the office?
Yeah, the best thing to do is call our office. We actually have an overview tonight if you're interested. There's no charge for you.
Great.
Just come in. It's at 7 o'clock tonight. We'd like to hear from you first, though, so call that number that you see on the screen. And then starting next week, probably on a Monday, we're going to start that 12-week program. So you can get into it if you come. So the overview is tonight. Let's get you in there tonight so you can learn a little bit more.
Awesome. All right, so no obligation. Go tonight and learn about it. And just call the number, make a reservation so they can make sure they have a chair for you, 839-1700. But if you have just put away all the full-length mirrors in the house and say they are banned, maybe this is for you and we can all do better. 839-1700, that's the number of the Aesthetic Associates Center. These folks are here for you. Try this holistic effort. This may be something that you haven't put all the pieces together before, but maybe you can after tonight. So go for it, and good luck. 839-1700. They're right on Kensington Avenue, 2500. That's the Aesthetic Associates Center in Amherst. All right, we'll take a quick break. Be right back. This segment was brought to you by Dr. Sam Shatkin and Great Look Monday.